one of the main concepts of spinal pain management that is demonstrated and utilized in the O'Connor technique is what I've termed diagnostic circumduction. Now, diagnostic circumduction relies upon the understanding that the spine can do a number of movements. For neck pain, which is what we're going to discuss right now, the spine, if the discs are normal, should be able to move 360 degrees in what is called circumduction. Circum, from the word circle, moves around in a circle. Now, most other techniques of management of spinal pain or neck pain or back pain or anything don't even address this. So if you went to a provider and you thought that that person adequately evaluated you and they didn't do a diagnostic circumduction, it's probably because they haven't a clue what it is. And if you ask them, well, why didn't you do a diagnostic circumduction? They're going to say, what? I have no idea what you're talking about. That's because it's unique to the O'Connor technique. I invented it. I thought it up all by myself 20 years ago. But basically, the understanding that you need is that when that center piece, called the nucleus pulposus, displaces, it's a physical impediment to the natural, normal movement of the spine, at least one of the movements, and that's circumduction. If it's bulged out to one side and you attempt to roll through that, your circumduction is arrested or interfered with. And what happens is it's like a pencil in a door hinge. You can't shut the door. You can't move through that spot. Now, the way to do that, the way to test whether your neck pain is due to a displaced piece of disc material is to stand with your shoulders relaxed, bow your head forward, hang it forward, hang just loosely, then lean to one side, preferably start at the side that hurts. If your right neck hurts, well then go to the right first, and you just hang, and you let your head hang, and you just hang it forward and to the side, to the right side, and then you lean as far as you can like this, and just let your head glide through its range of motion. Now, at this point, you look over your shoulder and continue that movement, bending back like this, and if that piece of disc material is out towards the periphery, it will stop that movement. You won't be able to complete the movement, or you'll get such pain that you won't want to. That defines one side of the pie, basically. You've got a 360 degree circle, and one side of that pie is stopped. That shows you where the edge is of that piece of disc material that's been pushed out. So what would happen then is you'd hang your head forward, you'd lean it to the side, you'd let it hang, you'd look over your shoulder, then you'd roll around, and then it'd stop you. And you'd realize that, wait, I just can't go further with that or it's going to hurt, so I stop. And you will feel that pain deep in your lower cervical spine. Now, to define the other side, where the other side of the pie lost range of motion is, after you've identified one side, you hang forward again, relax, lean to the other side, to the left in this case, look over your left shoulder and come back around like that. And as you get to that other side, it's going to stop you. Now, if it's very far out to the right, you may be able to go all the way back to the point where there it stops. Oh, and then you got to stop. Okay? That's because it's acting like that piece that's moved out is acting like a pencil in a door hinge. And you've reached the other side of the disc bulge. Now, this is very common in whiplash. And a lot of people can attest to the fact that when their neck is bothering them or they've got pain, they can't even look over to one side the same as they can the other side. One side usually you're able to look all the way over, no problem. And when you go and try to look over the other side, the side that the pain is on, you really can't do it. And a lot of people when they're driving have to actually turn their whole body to be able to see behind them like they used to. That's because that piece is moved out, and when they try to circumduct their spine, it gets arrested. It will not go through that pencil in the door hinge. And so we've defined the right side, and now we're going to define the left side. You roll around to the left, and you come to the other side of that bulge. You see how as you approach that, it begins to make it harder and harder to keep your neck bent backwards and complete the movement. And it gets to the point where it starts to hurt so much that you really can't do it. And so you've just defined that what your problem is a disc displacement syndrome. You can say, oh, you've got shoulder. A lot of people I've seen people who have their shoulders operated on for the thoracic disc syndrome, or no, thoracic outlet syndrome, because the doctors don't know how to diagnose a deep, low cervical disc displacement. And they have no clue that this is a technique that can be used to differentiate enormous amount of neck pain from shoulder pain or headaches. If it's high in the neck, doing this, let's show you. Just move the upper part of the neck through it. You'll feel that you're really losing range of motion. And if you're losing range of motion, it's because mechanically there is a piece of material, which is the nucleus pulposus, stopping the normal mechanics of the disc. And that is what we call diagnostic circumduction for the neck.